WYPL TV 18 presents Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Women in our lives tend to be the ones who take care of others. I know in my family, my wife Pam, the boss lady, she takes care of everybody, including grandchildren. But do women remember to take care of their own health? Today on Health Matters, we're talking about advancements in healthcare for women and changes at Baptist Memorial Healthcare. I'm Dr. Mark Castelaw, the Medical Director for BMG, the Medical Group. On our show last month, we told you about the new services coming soon and building expansion at Baptist Memorial Hospital for Women. It will include specialized children's services and an emergency room to get immediate care for our children. It's an umbrella of care that will extend to your entire family. On our show, under that umbrella of care, do you know that Baptist has a dedicated team for women's cancer services? Well, they do. And the latest advancements for surgeries and treatments. Today, we'll hear from doctors and experts who will tell you the risk factors you may not know. We're here to answer your questions about women's health because your health matters. BMG Oncology has locations in 3 states and treatment centers across the Mid-South. And soon, the umbrella of care will have a central location in Memphis. On today's Health Matters show, we're talking to Jillian Foster, the Administrator of Clinical Oncology for Baptist Medical Group. Jillian, thank you for being here today. Now tell me exactly what your role is at BMG.
I work with our medical oncologists, our surgeons, and our radiation oncologists, and I work with them and their practices for operational issues and patient care.
So essentially at BMG, all of the oncology services are under one auspice or one umbrella, so there's continuity of care between medical oncologists and surgical oncologists, correct?
Right.
Now, what makes Baptist Cancer Center different than other centers?
We think that several aspects of our service make us top-notch for our patients. We have multidisciplinary clinics such as our thoracic clinic and our malignant heme clinic, where we have physicians and surgeons, nurse practitioners, and other clinicians who discuss as a team each patient and the best plan of care for them. We also have nutritionists who can take requests from patients or physicians and develop a personalized nutrition plan for our cancer patients. We are also very proud of our survivorship program, which acknowledges that cancer care is a lifelong journey and deserves support and follow-up before and after treatment.
And I think that's very important because I see in my practice patients that come to y'all and are treated and successfully cured still need the follow-up emotionally and psychologically of dealing with what they just dealt with their journey through cancer. Mm-hmm. Now, what are some of the services that are expanding with the Cancer Center?
Today, we offer clinical trials to our patients all throughout the region in Tennessee, Mississippi, and Arkansas. With our partnership with Vanderbilt Cancer Center, we will begin to expand the number of clinical trials offered to our patients so they can continue to get those types of services right at home without having to leave their community.
Well, that is so important because I have a lot of patients that ask when we diagnose something like that about whether they should go to Vanderbilt or whether they should go to MD Anderson. But you're saying we have the same facilities and offerings that some of these places may have.
Right.
Well, what do you see as far as the future with Baptist Oncology Group?
We expect to see that oral Chemotherapy treatments will be a trend that increases. We will have a commitment to our patients to continue to monitor side effect profiles and compliance, even for oral chemotherapy. And we would want to make easily accessible options to our patients for oral therapy. Also, in cancer care, genetic testing is a hot topic, and the Baptist Cancer Center has genetic counselors who stay up to date and current on genetic tests, both diagnostic and treatment tests.
How do patients access you? Is the best way to go through their primary care doctor? Say they have a concern about they want to get screened for malignancy, or they have a genetic predisposition for something. How do they get into your system?
Our clinics are all going through the BMG referral line now, and so that number is working well to take patient requests and get them to the right oncologist, whether for screening or for treatment discussions.
Great. Well, thank you so much for being here today. And BMG has so much to offer in different specialties, and especially in oncology. And that, as Jillian just said, is expanding daily. So we're very fortunate to have a organization that we have here in Memphis. This is Dr. Mark Castelaw with Health Matters. Stay with us because we got more exciting guests on our show today. 1 in 8 women in her lifetime will be diagnosed with breast cancer. Baptist Medical Group has dedicated surgeons who see patients and understand the importance of the surgeon's role in recovery and treatment. Joining us now is Dr. Elissa Throckmorton, a breast surgeon with Baptist Medical Group. Thank you for being here today.
Sure, thanks for having me.
Tell me exactly what encompasses your practice. What do you do?
Sure. So at Memphis Breast Care, our practice has 2 and kind of half of a physician, and then also a full-time nurse practitioner. And what we do there is evaluate women for a spectrum of breast diseases and complaints, anywhere from breast pain to I've got a new lump to I've already had a biopsy and I've got a breast cancer, and what do I do next? And so we handle all of those different types of questions every day.
What are some of the newer treatment methods and procedures that are done now with women that are diagnosed with breast cancer?
One of the things that's newer that both Dr. Vanderwald and I did training in as part of our breast fellowship, which we use for appropriate candidates, is the nipple-sparing mastectomy. We're not actually saving any of the nipple tissue per se, but we're just saving the skin of the nipple, which provides a very nice reconstructed result, and sometimes can also trim down the amount of procedures that a woman has to have in order to have a fully reconstructed breast after a mastectomy. We also place, one of the newer types of radiation is a short-term 5-day radiation treatment called accelerated partial breast. We don't do the treatment in our office, however we do place the devices that the radiation doctor can use, and we do those under ultrasound guidance. In terms of medical treatments, similar, not things that we do, but things that we do spend a fair amount of time talking to women about at the beginning of their breast cancer journey, are things like using chemotherapy before surgery to shrink tumors. We talk a lot about endocrine therapy or different types of medication that are prescribed for women for estrogen positive cancers. And then also we talk to a number of women about ways to reduce their risk of breast cancer when they're found to be high risk, either from a family standpoint, family history standpoint, or previous biopsies that they've had.
Walk us through a little bit this journey that ladies have with breast cancer. They see their doctor, or they find a lump themselves, they get a mammogram, it's suspicious, needle biopsy is done, they have cancer. Then what? What's the next step?
Sure. So everybody's journey is going to be a little bit different, and and that journey may be different either because of the type of breast cancer that a woman has, or some of her other health concerns that may affect the types of treatments that we offer, or even some just personal preferences even, or some things that can change what one woman has as opposed to what her sister had, or her next door neighbor, or a friend from church. Most women start with a surgeon. The majority of breast cancer treatment planning starts usually with a surgeon. because most women at some point during their treatment plan will have surgery. And so we kind of are usually the initial kind of gatekeepers, or whatever you want to say, and start that discussion. Sometimes the next move is women go to surgery and have whatever they're going to have done. Sometimes, depending on what kind of tumor they have, we may send them to see other specialists before we make a final treatment plan. And we're trying to do more and more of that in terms of making a combined plan or a joint plan with other important providers. We've already talked about plastic surgeons, but radiation physicians, medical oncologists, sometimes even genetic counselors are part of that treatment planning process, because we do sometimes see women where the family history is such that we say, you know, this is somebody where maybe we need to look for one of these breast cancer genes before we finalize her treatment plan.
So you're the captain of the ship, sort of, to begin with.
I think most
you're
women
the first
feel that
face
way.
There. The next question I want to ask you is something I'm asked every day in the primary care clinic, because there's always controversy on television and radio about mammography.
Sure.
Tell me what the proper guidelines are for mammography.
The U.S. Preventive Task Force says let's start at 50. And that's because we see fewer women under the age of 50 diagnosed, and in that group you have more false positives. But I would say what most of the major medical societies, including the American College of Surgeons, American Cancer Society, the American College of Obstetrics and Gynecology, those groups all still recommend starting screening at the age of 40 for average risk women. There's one of the other questions sometimes we get is, well, when do you stop? And a lot of the studies looking at mammography enrolled patients, for example, under the age of 70 or 75. And so the question is, should we just stop at 70 for most women? And I think that question has more to do with a lot of the woman's other health. And as her primary care doctor, you're probably the best person to advise her on that. If you've got somebody at 70 or 75 who has a lot of other comorbidities, and you expect that in the next 5 years her heart disease is what may kill her, then screening may not be of benefit. If we find a little small cancer that we can cure, that may not effectively lengthen her life. However, you know, today I saw a very sweet lady over the age of 80 who, you know, takes one blood pressure pill, one cholesterol pill, and some vitamins, and that's about it, and lives by herself.
Aggressively take care of them just as well.
Right, and so, you know, my expectation based on some of the insurance actuarial tables is that her life expectancy isn't 5 years. Hers may already be 10 because she's made it to her age without another significant event.
Well, thank you so much for being here today. This is Dr. Throckmorton, and we really do appreciate her being here today. This is Dr. Mark Castelaw with Health Matters. Thank you for staying with us on Health Matters. I'm Dr. Mark Castelaw with Baptist Medical Group. Next, we have Marsha Kirby, a nurse practitioner with Baptist Women's Health Services. Marsha, thank you for being here today.
Thank you for having me.
Now, tell me what you do.
Well, currently I have several clinics. I have a benign breast clinic where I see women of all ages with benign kind of complaints, common complaints, breast pain, nipple discharge, breast lumps and bumps. And I work them up for what imaging they need, if they need a biopsy, and if they need surgery, we set all that up for them. Also have a high-risk clinic for those women who are at higher risk for developing breast cancer due to a family history or having first-degree relatives with breast cancer, or those women who've had several benign breast biopsies before. That does put them at a little bit higher risk. And then I see breast cancer follow-up patients in a survivorship program where they've been released by their surgeon or their medical oncologist.
Well, I'd like to take a little bit of fear out of what women sometimes experience when they do self-examinations or they find a little lump or bump. I know I've seen ladies, especially some younger ladies, that might come in with it. And of course, they're scared to death, obviously, and rightly so. So how do you benefit people like that, and how do you evaluate someone that comes in to see you?
Well, first of all, I take a history, and a personal history. How long have they known this change in their body? And a family history is very important. what we do is I'll do a physical exam after history and then determine what kind of imaging they might need, ultrasound, mammogram, maybe a breast MRI. There are several a lot of education to do to decrease their fears, number one, and to help them take better care of themselves. It's all about getting to know what your normal is. Because if they just do a breast exam once in a while and all of a sudden they think, well, I think that's a lump, if they don't know what their normal is, then they're going to think everything they feel
don't know what their baseline is.
Baseline, exactly.
Well, walk me through a little bit how you help in the recovery process.
What we do is still a lot of education. They have our phone number. Our nurse navigator is wonderful in that they still can call her if they have questions. They can call me with any questions. They can have late effects of their treatments, late effects of surgery with range of motion of their arm, lymphedema of their arm. They can have late effects from chemotherapy, like neuropathies or tingling and numbness in their hands and feet.
So the main thing is they're not ever abandoned.
No,
I mean,
sir.
even though their treatment is done, they're possibly cured of their illness, y'all are still there to support them and help them in any way, which I think is so important.
Absolutely. We never let loose of them.
Great. Well, thank you so much for being here today.
Thank you for having me.
Thank you again for coming. And we'll tell you about new surgical options for women and questions to ask your doctor next. This is Dr. Mark Castelaw with Health Matters. Having an annual visit to your OBGYN doctor is one of the most important appointments that women could have. But when your OBGYN doctor suggests surgery, what are your options? Well, joining us today is Dr. Azari and Dr. Kumar with Baptist Medical Group. Both of them are gynecological surgeons. Welcome, Dr. Kumar. Welcome, Dr. Azari.
Thank you.
First thing I want to talk about is exactly what is your area, Dr. Azari?
I'm a gynecology surgeon with the main concentration on advanced pelvic and minimally invasive surgery. And but basically our practice is covering the all benign and including health maintenance and also and including requirement of the surgery. But the niche of the practice mainly on the minimally invasive and advanced.
So you're addressing general gynecological issues, and also when you have to have surgery, then you specialize in this minimally invasive procedures.
That's correct.
Great. And Dr. Kumar, now you are OBGYN surgical oncologist, so you're dealing more with women that have been diagnosed by your colleague here with a malignancy, and then you're there to deal with it.
That's correct. I treat women with gynecologic cancers.
What are some of the new things that are coming down the line for ladies with uterine cancer and ovarian cancer?
Yeah, I think a lot of new and exciting treatments are coming through the pipeline. If we think about surgical options, then keyhole surgery is really taking off big time. Keyhole surgery means laparoscopic surgery or minimally invasive surgery. Also includes Da Vinci robotic surgery. A lot of the times,
and this is available.
This is available
with you. Okay.
Correct. This is available at Baptist Medical Group. We do it every day. So a lot of the times, these modalities provide you with less disfigurement, less pain, earlier return to work, and a lot of the times they have really, really low infection rates. We get lower amount of blood loss, and at the same time do fantastic cancer operation.
Well, oftentimes patients ask me if I do the laparoscopic surgery, will they get it all? Or will that surgery be as good as if you opened me up? So you're saying is your success rate in doing the laparoscopic is just as good as open procedures?
Absolutely. And not only that, I'm saying it, there are good large studies out there that have been done by the big societies that have proven the same point. Now, laparoscopic surgery may not be for everybody who has cancer. For example, when the cancer is disseminated or has, grown to different areas, then the surgery may not be right for you. And that's where you need a experienced person to guide you through that. But the point that I'm trying to make is that inquire from your physician that nowadays, majority of the times, we are able to offer keyhole surgery or minimally invasive surgery to treat your cancer, providing a quality cancer operation, oftentimes getting all the cancer out.
Good. What a great benefit to have that. Well, Dr. Azari, being a sort of a general practice with gynecology, kind of walk us through a little bit about, I get asked every day about pap smears. Are pap smears still indicated? How often do you do them? When do you stop doing them?
Actually, recently, about less than a year ago, American College actually modified the recommendation. And back, if you're going to take a look on the history of the pap smear, it was very tight and then gradually get less and tight for screening based on we know more about the pathophysiology of the disease. Based on, for example, many years we were talking about annual exam as an annual pap smear. Not anymore. The annual exam definitely should be done, but pap smear for every year. Based on the current recommendation, right now the American College of OBGYN, the first pap smear should be started at age 21, regardless of the past history of the sexual activity. This was against the previous recommendation. And basically, and keep going up to age 65, unless in the low-risk patient.
So what you're saying is start at age 21?
Correct.
And then every year?
No. After that one, if the patient is a low risk, if the patient have just cytology, just a regular pap smear, it could be done every 3 years. But if patient, especially after age 30, if you have a cytology and HPV test done together, we call co-test. If both is negative, patient need to come back for low risk as every 5 years.
Well, thank you, gentlemen, for being here today. I'm Dr. Mark Castelaw with Health Matters. Next, 6 million Americans suffer from this, and women are at more risk than men. Stay with us and find out what we're talking about. If you're just tuning in, this is Health Matters. I'm Dr. Mark Castelaw with Baptist Medical Group. Joining us now is Dr. Guy Fotopoulos, a wound care physician with Baptist Medical Group. Thank you so much for being here today.
Thank you, Mark.
Dr. Fotopoulos, we're talking about women has been sort of the topic of today's program, but I understand that women have a higher risk for wound issues than men.
They do for venous hypertensive ulcers. That's seen when the leg swells, the skin is stretched in the leg, and ulcers develop. Also, it seems that they have more trauma. We've seen a number of women only that close the car door and the edge of the door catches them in the leg, usually in the calf, sometimes going deeply into the muscle or creating hematomas. But otherwise, diabetes is a major factor for wounds, and that's pretty even. I think the healing rate and the care is good for both.
What is the definition of a chronic wound?
A wound is an ulcer or a sore, a break in the skin that could be just the skin or superficial or go deep in the muscle, the bone. And a chronic wound is one that in a reasonable period of time hasn't healed.
You mentioned briefly just a second ago some risk factors like diabetes. What are some of the other major risk factors for people with chronic wounds?
The risk factors for developing a chronic wound would be a person who's had a chronic wound in the past. Diabetes is a risk factor because people lose sensation or feeling in their feet, may have decreased circulation, and those things can combine for an ulcer. Sometimes the patient doesn't even know it if they don't check their feet because they don't feel it.
What's some of the do's and don'ts for people that when they scrape themselves or have a wound at home, everyone's going to try to treat it themselves. Everyone's going to try to put Neosporin on it and a Band-Aid and it'll get better. But what are some of the things that people shouldn't do, and at what point do they need to seek the care of a wound specialist?
Good question. First of all, not use Neosporin. We recommend Polysporin. Too many people develop allergic reaction locally to Neosporin. The wound should be cleaned. You can use soap and water or just water. Betadine or peroxide are okay 1 or 2 times, but then don't continue peroxide or betadine because they kill the healing cells. And don't let the wound dry out. A dried wound is like trying to grow cells in a desert. The wound won't heal. So that the thing to do is to clean the wound, dress it, keep it a nice, moist but not wet, warm environment. You may use Polysporin always.
Now, I know you're doing some breakthrough technology right now with your wound care with skin substitutes. Can you tell us a little bit about that?
We use 2 skin substitutes. One is a living cultured skin taken from not the patient but from another individual, cultured, sent to us overnight, shipped, and we place that on the wound, and it imparts growth factors to the wound. It doesn't actually stay as a graft, but sometimes stem cells do continue to grow and stay. Another product is a freeze-dried, non-living human amnion chorion taken at cesarean section. We put that on a patient today. It also imparts growth factors. Growth factors are those proteins that stimulate growth of blood vessels, skin, lay down the matrix to heal the wound from inside so the skin can grow across.
And what other advanced methods are you using with wound care?
I'd like to tell you about low-frequency ultrasound. It doesn't hurt, it's painless, it doesn't touch. We put the ultrasound to the wound and it penetrates almost 1/4 inch below the surface of the wound, and it stimulates positively all the healing elements and also decreases pain. The main side effect is you have to come 3 times a week to the clinic.
Well, what exciting developments that we have in wound care at Baptist, and thank you, Dr. Fratopoulos. We appreciate you taking time to talk to us today.
Thank you.
Thank you for staying with us on Health Matters. Today we've talked to the Administrator of Cancer Services with Baptist Medical Group and learned what's coming soon in cancer care. We met a breast surgeon and talked to experts about the next steps in cancer care. We learned how a team of doctors are changing women's lives by offering the latest in gynecological surgical care. And we discussed ways for women to manage care of chronic diseases and the after effects. The investments in care being made by Baptist for the future are truly remarkable in women's care. Next month on Health Matters, whether it's elective or emergency, we'll tell you about surgeons in the Mid-South. We'll talk to them about how to look for red flags that could save your life. Thank you for watching our show today. I'm Dr. Mark Castelaw with Baptist Medical Group, and remember, your health matters. So join us next month as we work to bring the latest news to keep you healthy.
WYPL TV 18 presents Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.